Ma'am, we are about to start.
Yes.
I hope the PPT presentation is there on screen, ma'am.
Yes, it is there on the screen.
All right, ma'am. So with all your due permission, it's 4. We are beginning with the session for today.
Yes.
Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our eminent speaker for today's session. Well, now Dr. Veena ma'am doesn't need any introduction because she's already been now a celebrity doctor, I must say that, and it's our pleasure and honor to have her at our platform and associated with us. So she's none other than the very renowned obstetric and gynecologist, Dr. Veena Shinde ma'am. Ma'am is MBBS, MD in Obstetrics and Gynecology, DGO, PG in Assisted Reproductive Technology, and consultant at Shinde's Medicare Hospital and Spandan IVF, Mumbai. With the help of ma'am, we'll be taking a close look on today's topic, which is vaginal dryness. So before moving on to today's session, let us have a brief look on what the topic says. Well, vaginal dryness is a common yet often overlooked problem that affects women of all ages, whether due to hormonal change, medication, stress, or other factors. This condition can lead to discomfort, pain, and reduced quality of life. We'll be learning about this particular topic by exploring into the world of vaginal dryness, offering valuable insights and expert advice with ma'am's wonderful input. So now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her for her precious talk to begin. Ma'am, over to you.
A very good afternoon to everybody. And it is rainy season in India. Vaginal dryness is generally known as winter vagina. In the winter, because of the cold weather, the vagina is often dry in the foreign countries. So it is called as winter vagina. So let us start. It's a very interesting topic, vaginal dryness. It leads to female sexual disorders. So it's very important for females to understand why the vagina is dry and what are the reasons and how to overcome this dryness in the vagina. Next. Atrophic vaginitis or vaginal dryness is a condition caused by thinning of the tissue, decreased lubrication, and low estrogen levels. Vaginal dryness is typical during and after menopause due to a normal drop of estrogen levels in the body. Next. What are the symptoms of vaginal dryness? Burning upon urination, frequent urinary tract infection, light bleeding after sexual intercourse, painful sexual intercourse, causing a decrease in sexual interest. Next. Sometimes vaginal discharge, foul vaginal smell, vaginal soreness, itching, burning sensation, frequency of urination. Next, a variety of causes contribute to vaginal dryness, including decreased estrogen levels that is seen in menopause and Sjogren's syndrome. Also, it is seen in autoimmune diseases and because of douching of the vagina. Because of the dryness, there's irritation, and because of the irritation, they keep on washing the vagina, and that causes increased dryness of the vagina. Also, certain medications, radiation, chemotherapy, illnesses, fever causes dryness of the vagina. Next, what are the causes of decreased estrogen level? Low estrogen levels are the main cause of vaginal dryness. The estrogen in a woman's body helps vaginal tissue healthy by maintaining normal vaginal lubrication, tissue elasticity, and acidity. These factors create a natural defense against vaginal and urinary tract infections. When your estrogen levels decrease, so does this natural defense, causing a thinner, less elastic, and more fragile vaginal lining. Estrogen levels also can decrease due to next menopause, perimenopause, childbirth, breastfeeding, cancer therapy, including radiation, hormone therapy, chemotherapy, due to the effect they have on the ovaries. Next, decreased estrogen level is seen in surgical removal of your ovaries, immune disorders, cigarette smoking, various medications. Next, decreased estrogen levels, allergy, cold medications, as well as some antidepressants, anti-estrogen medications, such as those used to treat breast cancer. They can also result in vaginal dryness. Sjogren's syndrome. This is an autoimmune disease. The immune system attacks your healthy tissue, and Sjogren's syndrome causes vaginal dryness as well as dryness of eyes and mouth because of the reduced secretions. Next, douching. The process of douching disrupts the normal chemical balance in your vagina. A pH of 4 is required to maintain a healthy vagina. It can cause inflammation of the vagina and may lead to the vagina feeling dry or irritated. Irritation in the vagina is also seen because of reduction in the lactobacilli, that is the natural protection of the vaginal flora, which is destroyed because of repeated washing of the vagina. So it is important that you don't douche the vagina very frequently. Just because of irritation, people start scratching the vagina, and that leads to fungal infection, bacterial infection, and it's a ongoing process. Dryness leading to irritation leading to scratching leads to fungal infection. So whenever you face a problem, you should go and consult a doctor and find out the cause and get a remedy for it. Though many women live with daily discomforts brought on by vaginal dryness, few make appointments to see healthcare professionals. If your vagina is dry, it is affecting your lifestyle. In particularly, it is affecting your sexual relationship with your partner. Make an appointment with a doctor, find out the cause, and get the remedy. Next. A doctor will typically ask you several questions regarding your symptoms and daily routine. Some might include: what vaginal symptoms are you experiencing? How long have you experienced these symptoms? Do you still have regular menstrual cycles? What is your diet? A diet is also very important to maintain a good vaginal flora. So, a diet with apples. Apples contain phytoestrogens, melons, all the juicy fruits also help to hydrate the vagina. Also, vegetarian diet helps in making the vagina more moist. Does the clinical condition limit your sexual activity? Do you use scented soap or bubble baths? Scented soaps and bubbles baths cause dryness in the vagina. Also, during the winter, you see people wearing lots of warm clothes, and because of the warm clothes, there is a little odor, and so they use perfume to overcome that odor. That also leads to a dryness in the vagina. Diagnosis of dryness in the what medications or vitamin supplements do you take? Diagnosis of dryness in the vagina includes a pelvic examination, PAPS test, urine test to be sure your symptoms are directly related to vaginal dryness. A pH test of the vagina will tell us why there is dryness in the vagina. Next. In general, treating vaginal dryness is more effective with topical estrogen rather than oral estrogen. Estrogen applied topically to the vagina can result in estrogen reaching your bloodstreams, but amount is minimal. Topical estrogen also doesn't decrease testosterone levels, important for healthy sexual function, the same way as oral estrogen can. Also, we have seen that vaginal lubricating creams also help in regularizing the dryness in the vagina. Vaginal estrogen therapy comes in several forms. Vaginal estrogen creams like Premarin, Evalon, inserted directly into the vagina with an applicator, usually before bed. Typically, a daily regime for a few weeks, then maybe alternate days, then 2 to 3 times a week, and later on as prescribed. That is SOS. Whenever you feel it is dry, you can apply the estrogen cream. Sometimes some patients cannot apply the estrogen cream, so vaginal humidifiers are also there in the market. Like we have Pelitra gel, Iserine gel, okay, and pelvic gel, which also overcomes this vaginal dryness. Vaginal estrogen therapy comes in several forms: vaginal estrogen creams and vaginal estrogen tablets. You get vaginal rings that release estrogen. Next, vaginal estrogen ring, a soft flexible ring inserted into the upper part of the vagina or inserted by you or by the doctor. The ring releases a consistent dose of estrogen and gets replaced every 3 months. Also, you have vaginal estrogen tablets that can dissolve in the vagina and can also keep the vagina moist. Vagifame, use a disposable applicator to place a vaginal estrogen tablet in your vagina. Your doctor will let you know how often to insert the tablet. If vaginal dryness is associated with other symptoms of menopause, like hot flushes, your doctor may prescribe estrogen pills, patches, or a higher dose estrogen ring or hormone replacement therapy. So, estrogen along with a progestin. Next, home remedies can also be used by women who suffer from vaginal dryness. They include over-the-counter lubricants, moisturizers like Astroglide, KY, Replens, and Lubrin. So overall, vaginal dryness can be treated with local applications or oral applications. But the most important thing is how to avoid vaginal dryness. Avoid using perfumes, avoid washing or douching the vagina repeatedly, avoid certain chemicals that can cause dryness in the vagina. Next. Next. Also, eating plenty of fruits, plenty of vegetables will help. Some items which you should avoid are vinegar, yogurt, douches, hand lotions, soaps, bubble baths that are scented that can cause dryness of the vagina. Next slide. It is a very sensitive topic. It is not much explored. There is not much literature on this topic, but I have gathered a few things for you so that you can understand how to overcome vaginal dryness. Any questions? Hello.
Yes, ma'am. Thank you so much, ma'am, for such a comprehensive talk upon such an important topic. The insights that have been shared by you were very crisp and short and very effective too at the same time. We have received few questions from the participants, ma'am. With all your due permission, I would like to put across those questions to you.
Definitely.
Yeah. So the first question is, are there complications or side effects of the treatment that has been suggested or the creams that we use?
See, Pelitra gel, Iserine gel, pelvic gel are non-hormonal gels. So there are no side effects. And if you use Evolon gel or estrogen gel, then if in case there is a history of malignancy, it can it can cause a recurrence. Although the dose which we give is very small, but you should avoid it in case of malignancy.
Thank you so much, ma'am.
Yeah, estrogen tablets should be avoided in case of malignancy.
Thank you so much, ma'am, for answering this question. We will take up the next question that we have received, and the question is, what are non-hormonal treatments for vaginal dryness?
Non-hormonal treatments are a good diet with plenty of fruits and vegetables, and avoid douching the vagina. Also, you should drink plenty of water so your body is hydrated, and you can phytoestrogens, that is soya bean, and apple also has phytoestrogens. They also help in making the vagina moist. And as I have mentioned earlier, avoid synthetic undergarments. Use cotton undergarments, which are white in color, which helps to dissipate the heat and improves the moisture of the vagina. And have a good healthy lifestyle, so chances of vaginal dryness are less. And go to the doctor immediately in case you are facing some problems, so that they can check and find out whether it is an infection or whether it is only dryness. Don't wait for the infection to occur, which is a side effect of the dryness and the itching that persists.
Thank you so much, ma'am. Thank you for answering this question. We'll take up the next question that we have received, and the question is, what are the complications of vaginal atrophy?
The complications of vaginal atrophy is the female sexual disorder. They start avoiding sexual intercourse with the partner. Then they face repeated urinary tract infection because of the dryness. There are cracks in the vagina because the skin is very dry, and that leads to infection. And infection leads to frequency of urination. Also, they don't understand whether it is a urinary infection or it is only because of the dryness of the vagina. So if you treat the dryness of the vagina becomes more healthy, and the incidence of urinary infection or frequency of micturition reduces. Also, the chances of infection in the vagina due to fungus or due to bacteria reduces. And you should also prescribe probiotics along with the local creams which we use for fungal infection, so that the lactobacilli in the vagina maintains a pH of 4.5, and because of maintaining the pH, the chances of infection are less.
Thank you so much, ma'am, for answering that question. We'll take up the next question, and the next question is, how to discriminate between fungal infection and vaginal dryness? What are the symptoms for it?
The symptoms overlap each other. In fungal infection, there is dryness, there is burning, and there is itching. And in vaginal dryness, there is not much of itching compared to fungal infection. So only when you go to the doctor can take a swab and find out whether there is a fungal infection. A pap smear or a swab or a general examination of the vagina, and that is why the patient should visit the doctor for this condition.
Thank you so much, ma'am, for answering this question. Another question related to this has come up. The question is, if there is fungal infection, what is the treatment to treat that?
You can give vaginal suppositories or oral medication depending on the age of the patient and what the patient is comfortable with. But you have to treat the vaginal dryness also, because the fungal infection can be an effect of the vaginal dryness which has caused itching and led to fungal infection. So you have to treat the fungal infection and also treat the vaginal dryness to prevent reinfection from occurring.
Thank you so much, ma'am, for answering this question. We will take up the next question, and the question is, how long does it take to treat vaginal atrophy?
It takes a long time, at least 15 to 20 days, and maybe they have to keep on applying the lubricant uh, as and when they feel dry. Initially, 2 to 3 times a day, then 2 to 3 times a week, and then at least once a week. They can avoid estrogen creams if they are not comfortable, but they have to use the lubricants that are there in the market to maintain the moisture in the vagina.
Thank you so much, ma'am, for answering this question. We will take up the last question for today's session. And the question is, vaginal dryness is a problem which women reluctantly speak about. So what is the issue behind it?
It is very discomforting. See, the woman is dressed up, is gone out for a function, and she feels dry and itchy in the vagina. It is very discomforting. She cannot stop itching, and she doesn't know what to do. And she is having a good hygiene. It's not that she is not maintaining a good vaginal hygiene, but there is uncontrollable itching, and that uncontrollable itching and dryness leads to scratching of the vagina. That can lead to bacterial infection from the nails, or that can lead to fungal infection, because there are cracks in the vagina, and that takes time to heal. So as soon as you experience the dryness, you should visit the doctor, get a lubricant that will help the vagina to become moist, eat good plenty of fruits and vegetables, juicy melons, so that you maintain your good hydration, drink plenty of water, and be healthy and be happy.
Thank you so much, ma'am. Thank you for your wonderful experts comment on this important topic that you have shared today. Thank you so much for this. And with this, we would also like to thank all the viewers for their interesting questions that they had put across to us on this particular episode of this particular topic. So thank you to all the viewers for your ardent participation. And with this, ma'am, with all your last comment, we would like to conclude the session here for today. Until next time.
Thank you.
Thank you so much, ma'am. Thank you for your valuable time.